Hello, thanks for coming. My name is Julie Glass and I'm a naturopathic doctor in Portland, Oregon. My clients often ask me, why did you become a naturopathic doctor? And why did you choose to work with children with autism? Well, the answer to the first question is twofold. First, I always knew that I wanted to work with people. And second, it was my heart's desire to help people along their healing path. I love so many things about naturopathic medicine. First, I love that I treat the person. I don't treat the symptoms and I don't treat the conditions. I get to sit and talk with people and hear their stories. All of us have unique stories, and therefore all of us deserve to be treated as the unique individuals that we are. Another thing I like about naturopathic medicine is that I get to be a detective. One of my jobs is to determine what is the underlying cause of the symptoms that we see. It's by reaching this underlying cause that I'm best able to help my clients. Therefore, I believe that medicine should be individualized. Let's look at something like autism as an example of a condition that requires very specific and individualized treatment. We are now facing what I consider is an epidemic in rates of children being diagnosed with a condition on the autism spectrum. The Center for Disease Control and the Department of Health and Human Services have just announced that 1 in 91 of our children are currently being diagnosed with a condition on the autism spectrum. To contrast that, the prior rate was 1 in 150 children. And 20 years ago, only 1 in 10,000 of our children were diagnosed with a condition on the autism spectrum. But it's not just autism whose rates is increasing. Over the past 25 years, the number of children diagnosed with learning disabilities, asthma, ADHD, and diabetes has tripled. 1 in 6 of our children are currently diagnosed with a learning disability. 1 in 9 are being diagnosed with asthma, and 1 in 450 of our children will become diabetic. Why? Well, what many physicians believe, including myself, is that there is a genetic predisposition that comes to life with an environmental trigger. If we look at autism, there are many different presentations. Autism can have neurological, immunologic, gastrointestinal, and metabolic implications. Children with autism often present with very unique and specific vitamin or mineral deficiencies, amino acid deficiencies, fatty acid deficiencies, or even neurotransmitter imbalances. Often these children have impaired detoxification pathways, which means that they're not able to eliminate toxins as the rest of us can. And almost every child that I see has some kind of sleep disorder. If we look at just how the digestive tract can be affected with autism, we can see things such as diarrhea, constipation, yeast overgrowth, bacterial overgrowth, just to name a few of the possible conditions. Often these children have very specific food allergies and sensitivities. Thus, it's apparent by looking at autism that this is a condition that warrants very individualized treatments. Healthcare catered to the needs of the individual. And since we are all unique individuals, we all deserve that kind of healthcare. I am so grateful to work with the wonderful, amazing, and unique people that I do. It's a privilege and a blessing for me to witness a child or adult open to the miracle that they are. And I'm grateful to be able to share this message with you today. Blessings.